Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
And our guest today, we love having her as much as she loves being on the air with us, Dr. Melanie Casey. Good morning.
Good morning. Thanks
Am I
for
right?
having me. Yes.
Yeah, she loves being here.
She has so much energy.
And so relaxed at the same time.
Yeah, it brings brightness to our room.
It's like we're American Idol judges, okay? Yeah, we're going to let you pass on through to the next round.
You wouldn't want me to sing.
Okay. Well, your voice is kind of raspy, but
It's
that's
always
normal
raspy. Yes.
all the time?
I always sound like, I have emphysema or something, but no.
It's
always like that.
Sexy, kind of gruff.
I love coming here. You guys are so good to me.
Well, welcome back.
Thank you.
And Dr. Casey is on staff with Mon General Hospital, but also at Cardinal Pediatrics. Cardinal Pediatrics has several locations now, doesn't it?
Yeah, we're located in Suncrest, and that's pretty much an 8 to 5 clinic, and we have a Saturday clinic there that's walk-in. So no need to even call. Just walk in Saturday morning from 9 to 1. And then our Cheat Lake office is open 8 to 8, Monday through Friday. And again, it's walk-in. No need to call. We want to see your kids the day that they're sick, not a week later.
We can talk about a lot of different subjects with you, and we have in the past, but I want to get your opinion on high school today. And people of our age think, I would never want to go to high school today. At least I think that way. It just seems to me that peer pressure, social pressure, economic layers and strata and depression and so many things, or maybe that's just what I hear about. Am I over-dramatizing the situation here?
Well, I think it starts even earlier than high school. These kids are starting to get into middle school and starting to have the problems, especially, the differences between the socioeconomic issues. I can remember being in 6th grade and not knowing who had what, or,
Never thought about it.
Never thought about it, but kids now are pretty, there's a lot of materialistic type things. But one of the biggest things that I'm coming across, especially now that we're having this evening clinic at Cardinal, is, I'm seeing all these kids and the mom brings them in, my kid's sulking, my kid's not talking, my kid cries all the time, or, and that sort of thing. And that's one of the things I wanted to address. What is normal, just puberty and getting kind of the ups and downs that go with that, versus a child that's truly, truly depressed, or a child that has clinical depression that may be at risk for substance abuse or suicide. And I want parents to really, really, really push their kids to talk to them, because believe me, I'll sit right in the kitchen and Chloe comes in and she just walks right past me. And that's easy enough because I've got stuff to do, she's got stuff to do. But, there's that time where you just kind of have to stop up in their room.
But teenagers just really don't want to talk to mom and dad.
They want to go in their room and close the door.
Exactly.
Or their friends, or get on the computer, do their Facebook, and kind of get all their anxieties out on Facebook, where everybody in the world's reading it.
Right.
I don't understand.
But they ignore us.
Yes. Yes.
I know, but it's our responsibility. We gave birth to these people, so we've got to go up there and say, "Hey, Chloe, what's on your mind? What's going on? What did you wear today?" Or I like
to have that relationship. A lot of parents do.
You have to force it sometimes. It's so easy with. It's so easy when they're young, and then they're all of a sudden somewhere about 10 or 11. It's happening earlier. In my opinion, at least the emotional changes. They go from being this sweet little, go clean your room, okay, mommy, to go clean your room. Well, why do I have to?
Yeah, right when they get old enough to be helpful,
they're not. Then they're not. Exactly.
I know. It just goes that way. It's the same way with sleeping,
Yeah.
When you want them to get up and do something, they want to sleep, but not when they're young.
I know.
I think a lot of it has to do, and perhaps you'll agree with me in talking with these teenagers, a lot of peer pressure, maybe even this word we're hearing a lot about, bullying, and getting through school without trying to be too noticeable, and then those are so outgoing. But does it come to peer pressure?
Peer pressure is around, and peer pressure is not always a bad thing. It's a good thing. So it can be a good thing if your peers are pressuring you to do the appropriate things.
Things.
But if these kids are getting into groups, and that does happen because naturally they try to find themselves about 10, 11, 12. You'll notice the child that you have to beg to shower and beg to wash their face and brush their teeth starts hopping up and showering. They start to be concerned about what they look like and who they are. And a lot of that has to do with their brain chemistry, their serotonin levels. And in adolescence, those levels kind of drop a little bit. And so there's a little bit of social anxiety anyway, and that need to belong. And that's where kids can fall into the trap of, okay, now I'm going to hang out where I've always hung out with these people. I'm going to hang out with these people, and they can go down the wrong road, and especially if they're depressed versus just a little bit, moody.
Then there is I'm sure, the teenager or even a younger child that tries to be the perfect child, tries to do everything right. If they get an A-, they're in a terrible mess. And I think it comes down to, in a lot of ways, trying to please their mother and father and be that perfect person that their mother and father are expecting.
And that's rough, too. It's usually young ladies. And, certainly I could throw Chloe into that. But I don't know where I factor into that. It's not really to please me. I think that, kids really set some high goals for themselves, and I want them to do that. But, it's important. That's where the talking comes in and really saying, hey, you know what? This is no big deal if you miss dance practice tonight, one night, or if you bring home a B in science, we're still friends, That's
sure.
good.
Is it hurtful? I don't want to say hurtful, but when mom and dad try to be their kid's buddy at the age of 7 or 8 or 9 years old, more than being a disciplinarian, I wonder if just not disciplining enough and being their buddy is harmful in any way.
Well, there'll be a happy medium there somewhere.
It's got to be a happy medium. And, 7, for me, 7, 6, 7, 8 is a little bit easier because there's just not as much. It's a lot more prompting. It's, hey, Ruby, brush your teeth. Ruby, brush your teeth. And they actually physically getting up, walking her, giving her the toothbrush. So there's not a lot of argument and stuff like that.
Yeah, try to tell a teenager that.
Right, exactly. So you can't, and then there's nothing that you can tell them. But to be there, you can be as strict or as lenient as you want. It's all about your parenting style. But there are some things that you just can't accept. Defiance, when a child looks at you and spits in your face.
Right, okay, so here's the deal. I mean, both of you have raised children. You're raising children. I've never raised one, but when the 4-year-old grandson comes over and I see him, when I say no and he throws a fit, I don't want grandma to give in. I don't want to give in because then he's manipulating us and he's playing us like a fiddle. That's my opinion. At 4 years old.
Yeah, kids do that, and they do. They get a reaction out of you. You say no, he has his fit, and then either sometimes men can be a little bit more strong in terms of this is the way it's going to be, and then but the motherly and the grandmothers, well, come on, let's do this. Get it back up. Don't do. But you know what? The best thing to do is once you say no, and if you really don't say no unless you mean no.
Let me just point something out here. Grandmothers do not say no, so don't
expect
exactly.
that.
I mean, that's
I guess
just a
I'm
rule in the
learning.
law. We don't say no.
I'm learning that.
My mom says no all the time to the girls. So that's
no.
the difference.
Well,
But
as they say, there's no directions. There's no roadmap for raising your children.
But you know what? If my advice to parents is, if you're going to say no, don't go back on it. So reserve your no's for important things. Like if your kid is tired and hungry and just losing it, well, that's not the time to reason with them. You just take them and either feed them or put them to bed or do.
Yeah, pick your fights.
Exactly. Pick your battles. And that's the same with teenagers. I can't even walk into Chloe's room without stepping on an article of clothing. And, and it drives everybody else crazy. And it does drive me crazy to some extent. But I think, if she wants if she wants to live like a bag person, a bag person that has a lot of clothes, for the record, though, that's fine, and I try to work on a solution. I'll say, Chloe, I know you don't want to live like this. How can we find a solution? And that's a really important part of parenting your adolescent.
And you find the solution by not pick them up and washing the clothes. Then when they want their favorite outfit, I'm sorry, honey, you left it on the floor there. So.
Oh, that's a lot of hassle in the morning. So. But and it's it's important to ask for their input. Here's a problem or here's an issue. How can we solve this? And her response to me with the clothes was, well, right now I'm so busy. I have to do something every single night. So in the summer, when I have a little more time, I'll organize my clothes. I'm like, that works for me,
See, to me, and what we're seeing with teens today and suicides, and I think there's so much influence on technology and on the computers and on Facebook and everything they're seeing and reading that is adding to trying to do better or becoming depressed and all those things together. So I think there's so many more outlets today for children.
Right, and we as pediatricians, we see it because there's just not enough child psychologists in this area or child psychiatrists in this area. It's a long wait. So they come to us first, and they'll say, oh, my God, what happened to my kid? Yesterday she was fine, but for the last few months it's been this, this, and this. And we are left to kind of tease out, well, is this just teenage angst? Is this just a little moodiness? Is this PMS? Or is this child really, truly clinically depressed? And they have, and it is hard to tell sometimes, but you're right, Kay, they can't get away from the bullying. They can't get away from, I mean, if I could just, I can't even go in the car with the girls without their ringtones and their Twitters and their, all that stuff. And so if they're fighting with a girlfriend, or it just goes on and on and
they
on
don't
and
escape
on.
it in the car with you. It still follows them.
It just goes, and they don't get that time. It used to be if somebody was picking on you, you leave Friday and you don't have to deal with that kid till Monday morning, if at all. But now it just goes and goes and goes.
Boy, I tell you what, we could spend a lot of time on the subjects today. I think of the young kids on Facebook, and I think some of them are looking for approval on there. There's some of the things they post. There's social do's and don'ts I think we all kind of understand, but when we read the posts of our young children or grandsons or granddaughters, it's just...
They have romance
Why
on
are you
these
posting
Facebook?
those things?
Yes.
It's like, oh, you've gone from a relationship to single and back and forth 5 times this month.
And you're 4 years old.
Yeah.
I love you and all this on Facebook. I want to know what you're doing.
All right. We're talking here, and you can participate. Fill up your cup of coffee during the break. Join us in the next segment. Pick up the phone. Give us a call. Dr. Melanie Casey is our guest with Cardinal Pediatrics. We'll be back right after this to Mon General's Health Talk.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Pediatrician Dr. Melanie Casey is our guest this morning with Cardinal Pediatrics and Mon General Hospital here on Health Talk. Let's talk about, and again, we're talking about teenage angst and depression, really that kind of broad subject right now, but so many kids now from broken families. And I know a boy whose parents split up probably when he was 8 or 9 years old, and now he's 14, and he hates school and getting in fights, and I'm wondering, how can we get this kid in the Mountaineer Challenge Academy next year? It's just you wonder, how is this kid falling through the cracks, or is this just a phase he's going through?
So that's a great observation and question, because that's what we're trying to tease out. Is this kid just going through a little rebellious phase, or is it because his parents are split up? Do his parents hate each other? Maybe he doesn't like, maybe the mom has a boyfriend that is living there that's an authority figure that he is rebelling against. Or, could he be depressed? Now, boys and girls are very different. Girls get depressed. We get all the credit, you guys. We have PMS. Everybody falls all over for us. Oh, my God, are you okay? Here's some chocolate. Here's this. But boys get depressed, too. And they don't sit around and cry in their tissues. They get aggressive sometimes and angry, and just they have like a short wick, and all that testosterone, all these hormones that are starting to come around, and they act out. And so normally and they talk back when they wouldn't talk back, and the question is this something that can be dealt with? And the sooner you deal with it, the better, because if you can't control your 14-year-old, then you can't control your 16-year-old and your 18-year-old. And to feel better, if this person that you're talking about is feeling so bad that they're acting out, and then of course they're getting punished. The parents are saying, well, that's it, no Facebook, you're grounded, this and that, and it even isolates them more, but they're not feeling better. And so that's the question. You've really got to get in there, maybe see a counselor, do some family counseling.
Go fishing.
Or
Take
go
that kid fishing.
Exactly.
I think that's probably the best therapy in the world, isn't it?
Structure.
I love it myself.
I think it has a lot to do with structure, too, giving that feeling of security to that child and giving them structure. And that's what military schools will do, Jim, when you mentioned Mountaineer Academy, that they give them structure and what they need to do to be responsible every day. And sometimes we as parents neglect doing that.
I agree. I do agree. And then there are kids that really need that structure. Children with attention deficit disorder, for example, really need a very structured life in order to perform to the best of their ability. But Some children you can be a little more laid back with. This particular child, if he still feels just horrible at the end of the day and nobody takes him fishing and nobody, they just are saying, well, we're going to take this away, we're going to take this away until you get better grades, and they're not putting the good time in, then he may turn to drugs. He may say, well, you know what? If I smoke pot, I feel a lot more relaxed and better. Or if I drink, this is when I feel better. And and that's how these kids start to go down that road. They're self-medicating.
You mentioned the ADHD, and explain that to me, because so many children are being identified as having that today, diagnosed. Explain what it is.
Well, it's funny. A lot of people think we see kids with ADHD. People are coming in now with pre-K. Is 4 days a week, and we've got this great, pre-K system in our area. They're coming in even earlier, 4 and 5, and they're saying, yeah, you know what? The teacher says my kid can't sit still. They can't sit at circle time. They can't focus. They jump out of their seat. They talk out of turn. They're in people's faces. These are symptoms. They act like they're driven by a motor of ADHD, true ADHD. And does it start in pre-K? No. You're born with it. And it's just that if it's a first-time child and they're first-time parents, they may think all kids are like that. And so it again, our job, because we're the first person that sees them, is we have to ask ourselves first and foremost, is this a problem with attention, which is just not a full development of the brain, or is this bad parenting or inappropriate parenting that's causing this behavior?
Back in our day, it was just high energy. That kid had a lot of energy.
You gave that kid too much sugar.
That's right.
304-296-0041 is our number. You're listening to Health Talk, brought to you by Mon General on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Slipping in before the time is over is Kirk, who's calling in with Dr. Melanie Casey. Good morning, Kirk.
Good morning.
Good morning.
Yes, sir. Go right ahead.
My 2-year-old son has been showing allergy symptoms for a little while now. So recently his primary care physician referred him to an allergist. And I don't know a lot about childhood allergies. And I was wondering what that testing entails. And then if he's found to be allergic to certain things, what safe treatments are available for, a 2-year-old. Well, what's on the market now that's safe for, a small child?
Well, Kirk, allergies are a lot more common than they used to be. And really, under a year of age, kids don't have a lot of allergies. But between 1 and 2, they can certainly develop environmental allergies outside as well as inside. So, if your child is rubbing his nose, rubbing his eyes, constantly has a clear, runny nose all the time, that may be, it may be an allergic issue. And so what would happen is you'd go to the allergist, and they do and they don't use needles. People always say, "Are you sick of needles?" It's a little scratchy plastic thing, and they just
hate to say it.
Yeah, it doesn't hurt though, because my kids have all had it. I've had it done, and they just kind of do that. And then what pops up is what your child is allergic to. So if they're indoor allergens like dust mite, cat, dog, then you have to alter that environment and do dust mite covers, get rid of the cat and dog, which is easier said than done. But but if it's outdoor allergens, the only options are giving them an antihistamine like Zyrtec or Claritin, which are perfectly, they're age adjusted down to 6 months. And then the other option is to do allergy shots, which I can't imagine doing for a 2-year-old. Yes, he would hate that.
But you do need to know what's causing it. That's number one, I'm sure.
Well, Kirk. I think, certainly if it's a food allergy, it's super important to know what's causing it, because you have to carry around the EpiPens with you. But if it's, I don't know how much avoidance you can do, because sometimes kids are allergic to everything, and it's like you can't put them in a bubble. The best thing to do is just give them that Zyrtec every night, or give them that Claritin every day, and just let them go on.
They have chewable Claritin now.
Oh, I know.
But take the child to the allergist, and there are treatments for 2-year-olds with.
Yep, you could do a nose spray, like a steroid nose spray, like Nasonex, taking that antihistamine Singulair. So there's plenty of stuff out there. And avoidance of the indoor allergens, I think, is the most important.
All right, Kirk?
Absolutely. Thank you, Doc.
All right.
Thanks.
Thank you for your call. And we're in the last minute of the program today. And I know you wanted to get into a whole other area, but we couldn't do it in 30 seconds.
No, we can't. So what we're going to ask is to let people know where you're located in case they have more questions and follow-up of what we talked about today.
Okay, so again, we're located in Suncrest Town Center, and we're also located in Cheat Lake, right by, it's right by Ashbrook Square, and we've got great hours. When they put our little bridge in, it's going to be even better access. I know. It says fall. I'm not sure. Anyway, we're open 8 to 8 at our Cheat Lake office, and it's a walk-in clinic. And Saturday clinic is a walk-in clinic at Suncrest.
All right, Dr. Melanie Casey, our guest on Health Talk, brought to you by Mon General Hospital.